hip and knee replacement is a resurfacing of an arthritic joint. People who have painful, heavily arthritic joints with damaged cartilage can have them replaced with artificial parts. And basically getting a new surface on the joint allows the joint to move without the pain of grinding arthritic bones together. The best time to consider a hip and knee replacement is when you're getting more pain, more significant limitations to function, and more problems with activities of daily life. So someone who is managing well with their pain and functionally able to do everything that they want to do probably does not need to have a joint replacement procedure. But people who are having more pain, more difficulty doing activities, joint replacement can be a great option for a surgery to correct that. When patients have a hip or knee replacement surgery, there's a couple different options about how long they will be in the hospital. We typically look to see when someone is safe to be able to go home, and that determines a bit about how long they may stay. For a lot of our patients, several of them go home the same day that they actually have the operation, probably about 30 to 40% of the patients that I do joint replacement on. The criteria we look at for when someone is safe to go home is that they are walking safely 80 to 100 feet, with a physical therapist, that their blood pressure is stable, and that they're able to go to the bathroom independently. Once somebody can do those three things, they're safe to go home. As I said, some patients go home same day from the operation. Others will spend one night in the hospital facility and go home the following day. Most of the improvements that we've seen in hip and knee replacement over the past 20 years have come in improvements in the technique that we do the surgery, not big improvements in terms of the actual metal or implants that go into the body. That's the addition of things like robotic-assisted surgery, robotic-assisted instruments. Those have been a lot of the big improvements that we've seen in surgery, as opposed to a new metal discovery or something like that. Hip and knee replacement recovery involves doing exercises. With hip replacement surgery, we typically will have patients doing exercises on their own, which were taught and directed by physical therapists as part of the surgery process. For knee replacements, they typically involve pretty extensive physical therapy with a physical therapist, where they are working on both strengthening, motion, helping them gain the strength and function back after the operation. Hip replacements typically take 2 to 6 weeks to recover in terms of no longer needing a walker or cane, whereas a knee replacement takes around 2 to 3 months to be walking without a walker or a cane on average. Revisions of hip and knee replacement could be considered if there are some type of problem with the implant, both in if it is no longer attached well to the bone, loose, unstable, improperly placed from the get-go, infected. There can be a lot of different reasons. There can be problems with joint replacements. If somebody has a joint replacement that's over a year old and is still having significant problems with either pain or function, it can be worth coming in to get it evaluated or get a second opinion to see if there are any issues with the joint replacement which are limiting the progression of that patient in terms of pain and function. In some cases, there can be problems identified with the joint replacement that could be corrected, and that's what we call revision hip or knee surgery. A good time to come and talk with an orthopedist about your hip and knee is any time that you feel your pain and function in your hip and knee are not quite what you would like them to be. Coming to see a hip or knee doctor does not mean you are signing up for surgery or that you must do an operation. Most of what I do in the clinic is non-surgical management. So we're happy to see patients, talk about their problem, identify exactly what it is, and what the treatment options are, including both non-surgical and surgical treatment options. So any person who is unhappy with their pain and function can get an evaluation and come up with a personalized plan of how to improve things.